All right, everyone, welcome back to In the Vet's Office. I am your host, Dr. Josie, and you guys are in for a treat. We have a very exciting episode today. Last season, we had Nikki Varva on, who is one of Nashville's most sought-after dog trainers, and we had such an overwhelmingly positive response to that episode. I said, we have to bring her back. So here she is. Welcome to In the Vet's Office, Nikki.
Hey, Josie, thanks for having me back. I'm excited to be here yet again.
I know. This is basically like... You know what you're doing now? The first time we were nervous.
Oh, I was very nervous.
I was kind of nervous too, but not today.
No, I'm ready for it now, I think. I had a lot of people, even people that come into training before they come in now, are listening to the podcast.
Cool.
To kind of, it's actually like, I'm like, hey, listen to my podcast if you want to come to training. It's like my new commercial.
I like that. It's great marketing.
Yes, yes.
And really the thing that we had discussed is that for me as a veterinarian and for you as a trainer, probably the number one behavioral thing that is brought to my attention in dogs, and I would have to imagine you too, is anxiety. And after our episode, I had so many owners messaging me saying, hey, my dog has separation anxiety or general anxiety. Like, can you talk about that? So I figured we could use this episode today to dive into all things anxiety in dogs.
Love it.
Before doing that, though, we are going to do our case of the week as always. And this case has gotten a lot of traction on Instagram. If you guys have been watching, I had a 5-year-old boxer. Her name is Okra, and her parents are amazing. They're like very attentive. And they, one day out of the blue, they were like, there's something going on with Okra's tail. We're not really sure. And they send me a picture, and lo and behold, there is a growth on her tail that looks like a toenail.
I saw that. I was like, what is that? Like, I was blown away.
I was on vacation when I get this text, and I'm like, oh, whatever you do, don't touch it, leave it. I'm so excited. Like, I can't wait to see this growth because it's like a very rare growth. And so I said, leave it, like whatever you do. Like, I'm so pumped. And I get home from vacation. It's Monday morning. First thing I wake up, I don't even need coffee that morning. I'm like, this is going to be so cool.
These are things you geek out on,
right?
Oh
my God. It's like the coolest thing ever as a doctor. I'm like, this is the case of a lifetime. And so anyways, went and looked at it, and it sure enough is rock hard, like a toenail. She's really sensitive on it. And she's got that like little nub toe. So it looks like a toe coming out of her toe,
right,
out of her tail. All that to say, we decide, yes, we should take off this growth, figure out for sure what it is. The results are in. I know everyone has been waiting with suspense. It came back as something called a keratoma. So it's not actually a real toe, but it is, for all intents and purposes, a toenail, which is keratin growing out of the skin.
And how rare is that?
Super rare. I mean, gosh, I took it off in a vet hospital where there were 5 veterinarians there. These vets have, between all of us, gosh, we have like 50 years of experience and maybe more, and none of them have ever seen a keratoma before. So it's pretty unusual. And I've been looking on, if you hear tap dancing in the background, that's because Saya's coming down the stairs. I just trimmed her toenails. I just lost my train of thought. Now I'm getting targeted on TikTok for about keratomas. Apparently in humans, there are toenails that grow out of people's heads. So, yeah. So Okra's
that's just something else now that, we need to worry
I know. And then really, so yes, it's a keratoma. And then really the big interesting thing was I went back to their house a couple weeks ago to look at their other dog. And the mom was like, oh my God, Dr. Josie, like, I'm so embarrassed. I was like, what? She was like, Okra went to the groomer, and the groomer was like, where did her toenail go? And the mom was like, what do you mean? And he was like, the toenail that's been on her tail that I've been trimming for 2 years. This groomer has been trimming the dog's toenail on her tail for 2 years.
And never said anything?
And never mentioned it. So then the owners had no idea and I had never seen it. I mean, I looked at this dog many times, but she has the longer hair at the end of her tail, and the toenail was getting trimmed, and yep, she's had that toenail for 2 years.
That's a common thing that groomers see that they're just not telling people.
He's like, well, it's just a toenail on a tail. Guess I'll trim it.
Like, the things we see in the dog world that,
like,
are normally unknown to people, but sometimes we're just like, I've seen it.
You're like, man, whatever.
Right.
He's totally unfazed. So yes, that is the story of Okra and the tail on her toe.
That's hard to say.
Oh my God, toenail on her tail. Okay. We are going to do our listener Q&As. We're going to kind of flip the script today. I asked Nikki I really rapid fire questions at you the last time you were here. So I figured it would only be right to let you rapid fire questions at me. I know you posted an Instagram asking people what questions they had. So I don't know any of the questions I'm about to get. So let's hear it.
So they want to know about debunking neutering.
Oh.
One, is it a behavioral thing? If you've got a dog that's got behavioral issues, if you neuter your dog, will it fix and cure all of your behaviors?
Okay.
And then really, do you have to neuter a male dog?
Okay, great questions. I would say, do you have to? No, you don't have to do anything. There are pros and cons to both. Let's start with behavioral issues. If your dog has behavioral issues, neutering it is definitely not going to fix the behavioral issues. I would say that comes a lot from training, and whether or not they have their balls does not matter at all when it comes to that. Now, I will say, if you're going to take them out and about and you don't have a dog that's very well behaved and they are intact, they definitely can have some like pretty intense energy and be going after females. So in that sense, yes, maybe it can help a little bit. But like if your dog has just like run-of-the-mill behavioral issues, neutering it is not going to be your one-stop fix. I will say the benefits, medically speaking, the benefits to neutering are, I see dogs that are older that get testicular cancer. And so neutering them eliminates the likelihood of them getting testicular cancer. And then the other big one is intact males can get prostatic disease. So they can get prostatitis, which is an infection or inflammation of their prostate, which can cause really big issues with them urinating. And they may have to be on lifelong medications. And so neutering them can really help with that.
Makes sense.
Yes.
I mean, it does make sense. A lot of times, people will call in or, call me and be like, hey, I'm going to neuter my dog and he's still acting aggressive and everything like that. But I'm like, well, neutering your appointment, you can keep it. I don't care if he comes in with balls or no balls, but it's not going to fix, the behavioral issues that you're having. So it's nice to clear that up.
Yes, definitely.
So the next one actually comes from a trainer, which was super cool to me because we like to do preventive care, cooperative care. We're messing with dogs' paws, their ears, their mouth, and just getting our hands all over them. But we want to know, what can we actually do, owners and trainers, what can we do that will help veterinarians when we bring dogs into the vet?
Yes. Oh my gosh. I love this question. The second you get a puppy, or any new dog really, but especially puppies, because that's when we have that's like prime time to desensitize them. Get your fingers in their ears, in their mouth, touch their toenails. The majority of what I'm doing as a veterinarian is I'm doing a full exam. So I've really got to get into their mouth and look at their teeth. I've got to flip those ears over and stick my otoscope in. My nurses have to trim their toenails. And naturally, most dogs are going to be like, hey, get away from me, lady. Like, I don't want you doing that. But if they're already desensitized and their owner's doing it all the time, that makes my life so much better. And it makes the dog and cats so much less stressed at the vet.
So is it good for just the owner, or would you recommend like other family members touching the dog as well to help with not just being okay with the owner touching them, but maybe somebody else within the family touches them as well?
Absolutely. Yep. Everyone in the family should be able to do exactly what the owner's doing. And that really goes with socializing. So getting them social around other people, asking your neighbor's friend's cousin that's over for the barbecue, hey, do you mind feeding Fluffy some treats, and like looking in his ears? Just that way, when it is a stranger like me and a little bit more stressful of a situation, they are not as nervous.
Right. I mean, that's really good advice, but it's also too, is let's go on the other spectrum, is you have an older dog or you rescued a dog that is terrified of the vet. Mm-hmm. When would you recommend, and maybe what situations would you recommend maybe saying, hey, let's give this dog some trazodone? Mm-hmm. Because we think about this as we see you guys, I don't know, maybe if we're lucky, you know what I mean?
Yeah.
Just coming in for the shots or something like that. But it's not a great experience. You're poking on them, prodding on them, doing all kinds of things to them. When would you tell an owner to be like, hey, let's, just for the vet visits, let's get through this to where it's an experience that we can get through? When would you recommend, and what procedures would you recommend that the dog comes in on something that kind of levels them out to feel okay?
I think that's such a great question. And I always joke around with my nurses. I'm like, can you imagine not being able to talk? Your mom or dad taking you to this random place, this random lady sticking her fingers in your mouth, in your butt, like looking, giving you shots, like how scary. So I would say, first and foremost, if you can find a vet clinic that practices fear-free handling, that to me is really important. That is a certain style of handling that they do at the clinic that's really low stress for the animals. And they've done a lot of like work with understanding nonverbal cues in our dogs and, oh, like this dog's licking its lips, it's probably stressed. So that's kind of first and foremost. Secondly, trazodone has a time and a place. I think what I really focus on is how urgent do I need to look at this pet and assess this pet? Like, how urgently sick are they? So if it's like, hey, this is the first time Fluffy's been to the vet, we've never met him before, he's a little timid, I'm going to be sitting on the ground with them, offering them treats, lots of positive reinforcement.
Cheese, right?
Lots of cheese, squeezed cheese. Honestly, Kraft should just start sponsoring me at this point. So lots of positive reinforcement in that sense. And I really recommend doing happy visits to owners that are nervous to go to the vet. I say, hey, bring Fluffy in, get him on the scale, give him a snack, like let him get used to the smells that are here. I will even take 5 minutes out of my day during a happy visit to come say hi to the pet.
Now, a happy visit is something I have never heard of until this trainer, you had worked with her dog, the happy visits. Her name is Riley, and the dog's name is Luna.
Amazing.
Doesn't like to be touched, doesn't like the whole, doesn't like ears, anything like that. But you did happy visits. And even now she can go to the vet and has good experiences for it. But I had never heard of, because I feel like you guys are so busy. Mm-hmm. You know what I mean? And I don't think owners honestly know that you can do happy visits. And I don't know if every veterinarian does that, but I think that is just like you come in, you get some treats, you're here.
Yes.
You don't get anything in your butt.
Exactly. I don't have to stick my finger in your butt every single time. Like, what a concept. So, happy visits. I remember Riley and Luna. Luna is a nervous girl. Mm-hmm. But happy visits are so important. And if your vet, maybe they don't recommend them, but you can still swing by your vet anytime. And if you bring it up to your vet, I guarantee you your vet's going to say, heck yes, please come on in. Now, if they are really sick, let's say, and I really need to get my stethoscope on them, I really need to get inside their mouth, I have to draw blood on them, I'm going to probably recommend giving them a little trazodone before. Trazodone is super safe. It is never my goal to like zombie out your pets, but if it's going to make them a little bit less stressed and make me able to get done what I need to get done, then I definitely think there's a time and a place for it.
That's very good. I mean, I totally understand that. Yeah. So very good. That's all the questions we had, going into it. A lot of, questions again are just your basic ones that I think you've already answered in your, your other podcasts. Yeah. And I always tell people to continue to listen. This is my favorite podcast because I'm never stopped learning, but I also know when I listen, I'm like, I didn't know that.
Fun little nuggets of information. Absolutely. And some laughs here and there.
Absolutely.
Okay, Nikki, let's dive into anxiety in dogs. I'm sure this is like what you do all day long.
All day long. All day long.
How would you say, so a lot of times owners, I'll see a dog that comes into the clinic. Now, coming into the clinic is not like a great baseline to tell if a dog's anxious or not.
Right.
Now that I've started a concierge practice, I am going into people's homes, and I think that allows me to see like the general demeanor of the pet. Mm-hmm. And I'll be like, oh, this dog to me seems generally anxious. Oh, now we have Biggie coughing in the background. We've had Saya tap dancing. Now we have Biggie coughing. So to me, I'll say, oh, this pet looks generally anxious to me. And the owner will say, oh, really? Like, I never thought that. Or the alternative of an owner's like, I think my dog's anxious. Mm-hmm. How do you tell owners, what are they looking for when they can deem whether or not their pet is anxious?
I'm going to honestly say 99.9% of dogs that I encounter are anxious. Mm-hmm. And what does that look like? It is, it goes into behavioral, which most people see is, the shaking and the panting and maybe some drooling or being afraid of people. Like all of that is, anxiety, but also too is your happy-go-lucky dog that cannot settle when people come over, that, is just all over the place and jumping on people. That's anxiety because your dog doesn't know how to act in a situation. Mm-hmm. And so if you think about this is if the dog doesn't know how to act in a situation, then they are going to be anxious because they don't know what to do with the overstimulation or being afraid or being fearful and all of those things. So it comes out in different ways. You have some dogs that flee and you're like, oh, they're scared and they're anxious. But even to the dogs that are all up on people, hyperactive, that doesn't mean that your dog is happy. Right. I mean, it can be, but it's also to your dog is anxious because somebody's in their home or they've met somebody or a new dog comes in. It doesn't matter. They just don't know how to handle the attention that they're getting or what has changed in their environment. What people see is when you see a dog that's neutral, that's what I teach is neutrality, is being able to have guests come in or being out at a coffee shop and my dog is just laying down. I get so many comments. They're like, is your dog okay? So I'm like, yeah, he's just chilling.
Yeah.
He's calm. And so a lot of times people say they're like, oh, and so they don't understand that a calm dog is a happy dog. A crazy, over energetic, out of control dog, or a fearful dog, of course, is not happy. They don't feel good.
Right. And they can't talk. So a lot of times that anxiety, it does manifest as like hyperactivity, whether it's humping. That's a big one where dogs are like, wow, I'm so amped up. I don't know what to do. And they just start humping things.
Or they even start nipping and then they start pulling on your clothes and then that turns into growling. Or even I've had dogs that constantly lick. Like they can't control their licker.
Yep.
You know, like.
Yes, exactly. Licking is
because
a
they're
huge
just,
one.
licking is a soothing thing for a dog. But then also two is like they can't control it because they're just like, you're like, I don't know what to do. And so I need to lick. And some people are like, oh, they give kisses. And I'm like, your dog just doesn't feel good. That is anxiety.
Yeah, he's scared.
Yeah.
It's funny you say the dog's jumping up because I do have a lot of dogs, of course, at the vet that are nervous and like cowering in the corner. And then I have others that are like parkouring off my chest. I'm like, oh my God, like I'm taking hit after hit. Like they're just so jacked up.
Yeah.
And I would love to say, oh yeah, they just love me and they're excited. But like, I do know that realistically they're nervous.
Yeah. And a lot of it can be, it's a bad behavior too, is one is like, you're not going to touch me and I'm going to jump on you. I always tell people like, you're not going to maul somebody that you respect.
Yeah. Yeah, you're not.
So, a lot of owners are like, oh, they jump on me only because your dog doesn't respect you. But it's also, too, is like a lot of times, too, you can ask a dog to do something and they're like, no, and they jump on you because they're like, get away from me. Or even, too, they're anxious and they don't know and they're kind of like, it's just a behavior. They're just all over the place. They're just, bouncing from one place to another.
One thing that I also think is so important, I wish I would have had this, I'm thinking of one client in particular, and I wish I would have had the term, a calm dog is not a sad dog. A calm dog is a happy dog. I have one client that I can remember where she was always like, I feel so bad. Like my dog, he like, I'll be working at home and I'll see him sleeping and he just seems so chill. And like, I just feel bad. Like I think owners think, oh my gosh, I have to stimulate my dog. I need to be taking him for walks. I need to be running him and doing this and doing that. And like, that's not the case.
That can actually make your dog a dopamine junkie. Because if you think about it, we feel good. Like, I love to go to the gym. Like, I get to the gym and I'm like, this feels so good. And so it makes me want to go back. Or things that we do, like people run and do things. So dogs, yes, they love to. I mean, I could throw a Frisbee for my dog all the time. And he would constantly go. But that's not actually, rewarding. But also, too, maybe 5 minutes of playing Frisbee now has to be 15.
Right.
Now my 2 walks a day are like 6 walks a day and miles and all of this stuff. So you're making your dog really actually be anxious because they want that dopamine.
Right.
And when you ask them to be calm, they can't because it doesn't feel good.
Right. And I think it's like, dogs are not necessarily like us. Like they sleep a lot of hours of the day. With that said, of course, we want to exercise them and give them their meet their basic needs, of course,
right,
and stimulate them mentally. But like, it is okay if your dog takes very long naps all throughout the day. That's 100%. Not a bad thing.
And it's crazy is when I have dogs, that come in, that teaching them the off switch is the hardest thing. And it's not like I can talk to a child and be like, hey, we're going to nap, or anything like this, but they just literally can't turn off because owners, this is where anxiety comes in, is they have access to anything and everything they want 24/7. So when you take away that access, they're like, I don't know what to do.
Yeah.
I can't. Like, I need to be with you. And so what owners don't think about that is we all love when Fluffy follows us around. It's the cutest thing because we're like, look at my dog. He really loves me. Which I'm not going to burst people's bubble. Like, yes, the dog wants to be around you because they are pack animals. But what's happening is you are their job.
Right.
So with dogs, when we bring them home,
this is touching on separation anxiety.
Yeah, and separation anxiety and just anxiety in general.
Okay.
So when we bring dogs home, is we have to understand that they are born in a pack. The mother is telling them when they're going to eat, cleans them and does everything, right? When we bring dogs in, whether it's a puppy or an adult dog, is we bring them in and automatically and instinctually in a dog is what they're looking for is safety, protection, and direction of the pack. If you're not providing that, then the dogs will swoop in and they will take that role because that is how instinctually they survive in this world.
Crazy.
It is crazy. So when they come in and you don't provide that, then you have dogs that are insecure, that are driving the bus and literally are driving you off cliffs. And
you're like, what is happening?
Or you have a confident dog that comes in and is like, okay, cool, I love this. And I'm going to do everything that I want. And then of course too, is when you're trying to ask these dogs to behave, they can't because you've never led them. You can't spot clean behaviors. It's a lifestyle that you live with your dog.
So let's say a listener is listening right now. And they're like, okay, my dog, we'll start with a dog that has separation anxiety. What are those sort of, like, how can an owner start taking control and setting boundaries? Like, where do they even begin with that?
Well, first is if you don't have a crate, you better get one. Like right now, Amazon it, get it sent, prime it over is the crate, right? So again, we think about this as they are pack animals, and a lot of times people think that they do need to be in the pack, but we have to teach them to live in a human world, which is to be okay away from the pack. And that is one, not instinctual to them. So we have to teach them that. So having a crate, but setting boundaries is, I tell anybody, when you bring a dog, I don't care age, you bring them in and you can start tethering them. Tethering is one of my favorite things. This is prerequisites before you come into training with me. You get a rescue dog. This is a lot of WAGs dog do this, even Fosters, is so the dog comes out of the crate. You have them on a leash and you're literally leading them to where you want them to go potty, to get water, to whatever, right? So the dog is understanding that this is the routine that I do. And that's something that is every day. And then when you are lifing, like you are working or you're making dinner or you're playing with your kids, your dog should be tethered, meaning you take the leash, you take the loop in where you would, the handle, and you're attaching it on the outside of a door and you're closing it to where they can't move. You know what I mean? So they're literally the dogs that have separation anxiety, they're gonna sit there, they're gonna pant. They won't even lay down because they can't.
They are able, like they have enough leash to lay down if they wanted
100%.
to.
They just where they can't wander. Like a 4-foot leash is perfect. So they can lay down if they want to. They can kind of move, but you're also in an area where they can't get into things. You can put a bed down if you want to, but I guarantee you that anytime I do this, dogs aren't gonna lay down. They're just going to be like, what do you mean I can't get to you?
They're going to have like a panic attack almost.
Oh, they do. You know what I mean? And honestly, that is like the first thing they do is they'll just stand there because they don't know how to life without you. And that's the first step you start with setting boundaries is like, I'm eating dinner, I'm cooking dinner, just hang out. And then it's also good for dogs that are very nervous is you get a new rescue dog and they're like, oh my God, this world, like, what am I going to do? You tether them and they feel comfortable because there's not pressure of you constantly being over them or hovering, that they can be like, oh, okay, well, somebody walked by and they didn't bother me.
How long after you start, I have two questions. How long after you start tethering do you find that they start to settle? Like most dogs, would you say?
It just depends, you know what I mean? It really does. It's not like breed specific or whatever, but literally, so I do tethering, day one and going into it. Day one is typically your hard point. Day two, they start to lay down. But they may not be fully settled. They'll lay down, but if I move, they may stand up. So they start, what it's doing is they don't speak English. So I can't tell the dog just, hey, why don't you sit here? Yeah. Why I'll go over and do this it's teaching them to take their stress. So that dogs have a very low stress tolerance. Most of them do, meaning anything and everything can just amp them up. So what I'm doing is their mindset is way up here and they have to learn to self-soothe on their own and be like, oh.
Okay, so I have a lot of owners that will say, I put Fluffy in the crate and he cries and cries and cries. And they either, I think at that point, will give up and say, Fluffy can't be in a crate. Or let's say Fluffy is actually trying to kill himself in the crate. What do you say to those people? And at what point should people be like, I need to give up on crate training?
Oh, those are good questions. If Fluffy, of course, when you first get a dog, crate training is, a process. It's not an event. That's with anything is, I think people will be like, just throw the dog in the crate and then expect it to be okay. Is a process going into that is maybe just having a leash. And I recommend when you're doing crate training is you're using a leash that you are, so that way you can navigate. So again, your steering wheel. If a dog says, I don't want to go in, you can kind of use the leash to put them in. And what you're doing first is just going in and out of the crate. Don't worry about leaving your dog in there for a long period of time. You're just going in and out of the crate, feeding your dog in the crate, making it become something that is valuable to them. Like most dogs are, I'm sure you got your labs, you got any dog that is like, I love food. You put it in there and they go in there and they eat and they come out. So you're just starting to do very little with the crate and you're building up on it. But also too, is you have to know that going into the crate, yes, is away from you. But if your dog can't be okay with boundaries outside of the crate and you're not establishing those, your dog's not going to be okay away from you in a closed-in confinement area.
Right.
So again, when you're practicing those crate trainings, again, is you're having them in the crate for some periods of time and you're going to let them cry. And what is really, I have a lot of owners that have kids and I talk to them about this and I'm like, it is nap time. You know what I mean? And you had a kid that is fighting you and you're like, no, that's it. And you're putting them in there. I was like, do you feel bad that when your kid is crying, you're like, no, because it's nap time. why is it that you feel so bad that your dog is crying in the crate? It's the same thing, you know what I mean, that they go in. And I also think that too, that owners get this, and a lot of trainers, we do say this, is don't go let your dog out when they're crying, right? But as you're building this up, if you think about this, you have to life. So let's say you put your dog in the crate, but now you have an errand that you're supposed to run and your dog is crying, but it needs to go potty. And you're like, I can't wait. And so what owners do is they're like, I can't wait. And they start giving in. That is okay to be like, it's having issues. I'm going to go in, nonchalantly open it up, put it on a leash and take it out to potty and bring it back. That still is crate training. Mm-hmm. You know, you can't wait for the peace and quiet because it's not going to happen in the very beginning stages. So it is okay to still be like, okay, you're throwing a fit, but we have to do this for me to be able to life. And you can bring them out. But again, it's you're practicing and building up. Now, the dog that absolutely is self-destructive, you know, is breaking teeth, is, you know, one, I do not recommend that a dog that has separation anxiety do not use a wire crate at all, because they will find, it gives, you know, it kind of, there's different things they can figure it out how to get out of it. Is I recommend getting a Rufflin crate. Or an anxiety crate.
A Rufflin?
Yeah, Rufflin is a brand. So Rufflin is like a heavy-duty plastic crate. It's what I travel with in my car. It is a crate that literally is known for rollover protection, meaning if you were to get in a wreck, or I've even seen it in tornadoes, the crate is still standing.
RUFF land, LAND.
Yes, RUFF land. Yes, those are the best crates. You know, then of course you can go even higher and get an impact crate that is metal. You can find these things on Facebook Market, but if you have a dog that's in a wire crate, they can grab the crate with their teeth and pull in, and then you're going to get chipped tooth. Now, not only is your dog not crate trained, but now you got to go see Dr. Josie because she's got to do a tooth extraction.
Those wire crates are my job security.
Yeah, and you kind of think about it too, is that, you know, now your dog has hurt themselves in the crate. And a lot of times too, once they freak out and they keep going, they're finding any way and every way they can. And then of course, don't put bedding in there. If your dog is got anxieties, don't worry about bedding right now, because then they're going to turn it into what I call a snowstorm. Yeah, they're going to come in. It. Oh yeah. And then they're going to ingest that, or there's so many things, you know, going into it. But again, is on those things, when I think about it, is if you have tried, you have literally done everything you possibly can, you know, worked with a trainer, you have done all you can with the crate, and your dog literally just, you know, cannot do it. Then I suggest, let's talk to our vet. You know what I mean? Is let's still do the things that we're doing, but let's maybe add some trazodone to where maybe the crate now is, because as soon as they see the crate, I've had dogs that start panting when they know they're going to go to the crate. So we kind of start breaking that down. But if a dog is literally hurting themselves, I don't want that. You know what I mean? I don't want to be, you know, then people become prisoners of their home. They're like, I can't leave because my dog can't be crated. So then maybe let's try some medicine, you know what I mean, to see if that helps. But then there is dogs, I can think of a WAG dog right now that can only be crated when they know the owner is home. If not, it has chewed through a Rufflin. And I've never seen a dog chew through. I mean, this is thick plastic.
Wow.
So, you know, long story is they're like, it does fine outside of the crate, you know, when I'm not home, and it's like, okay, kind of is what it is. But then it's also too, is like, okay, when the owner comes home, is now we have those boundaries, you know, going into it. But it's very rare that I've had many dogs that come in that are not crate trained. And I'm telling you, within 3 days, we've made extreme progress.
Yeah. I would say in my experience, like 99% of them can be crate trained. 100%. It's a process, but if they are falling into that 1% where they're trying to hurt themselves, and I don't mean just crying a little bit, like we're talking like they're breaking their teeth on the bars, then you can probably do something where you can like put them in more of a confined space, like a laundry room or something along those lines.
And it depends on the dog. Is it destructive? You know, is it, you know, you just kind of have to see the scenario part of it. But honestly, it really is, it's the owner that feels bad about the crate that really is putting a feeling on the crate. If you are also too like, it's okay, let's get in the crate, and you're doing all these things, the dog's like, I don't know, you sound worried, I don't want to go in that.
I think that is really important. And I am such a baby. Like I would literally rock my fur babies to sleep at night and tuck them into, I'm such a baby, but like putting Oakley into the crate, which is my big German Shepherd who went to training with you, I would be like, I'm so sorry, mommy will be back, I swear I'm coming back for you. And he's like, what? You know, like,
and then he's an anxious dog,
and then he's nervous.
So then it's, you know, like, again, we talk about energy, and what is that? You know, when I do things with a dog, is I've got a dog that's super scared right now, and if I were to coddle and baby and, you know, just be very like, you know, even just with my emotions, really internally feeling it, it's going to make him even more scared. So it's a lot of times too is, you know, getting him into the crate is just like, it's a crate, And if you think of it as this is a safety mechanism for our dogs.
Yeah.
You know what I mean? That it can literally, I mean, I'm sure you've heard of this. And I think even the last podcast I was here, you had 3 dogs get in a fight because they weren't crated and they got in a fight over food. And one got, I don't know, severely injured.
Severely.
You know what I mean? And the crate could definitely be a life-saving mechanism, but it's also, too, is part of boundaries in your home.
And the one thing that you've said to me time and time again that I think makes me feel a lot better is when you put your dog in the crate, that's their opportunity to turn off. They can be like, I can just let my guard down. I'm in my safe space. I don't have to worry about anything. And that, I think that's so important to allow them that opportunity to turn off.
And especially good, too, as you think about a lot of my clients have kids. And you're running around with a newborn or toddlers, and you're already just, there's so much going on. And a lot of dogs are like, this is overwhelming.
Yeah.
Like, I don't want to be here. And then what happens then, too, is you may get your dogs growling at your kids because they are overwhelmed and the kids are coming into their space and they don't know what to do. And you could advocate for your dog and be like, hey, this is a situation that, like, kids just came home from school. It's crazy going on. I can crate my dog. And your dog will thank you. Your dog will be like, thank God.
Yeah.
Like, I needed a break.
Yeah.
You know what I mean? And going into it. But it's also, too, is I love using it for training is I may go out and do a hard session with a dog where I know, like, today was a dog that doesn't want to get in the car. I mean, he's panting and we got through it. But what I did is I didn't just say the session is ending and went inside and loved all over him. You know what I mean? I did pat him and was like, nice job, kid. You know, like you did it. But then I went in and I put him in his crate. And what that does is allow him to think about the whole situation.
To decompress.
Yeah. You know what I mean? And really think about it. So a lot of times, too, is people get out and they may have a reactive dog and they're a stressful dog and they put them in a situation. But then again, is they're not letting them just kind of settle and be like, I didn't die. You know, like I'm okay. You know, and just letting them have their moment of being okay and being alone.
To process. The same with going into the crate. And another thing that you've taught me is getting them out of the crate. And even when you come home from work or you come home from running an errand, not doing the whole song and dance of, how are you? You're a good boy. Like, I know we're jazzed because seeing your dogs is the best thing ever.
It is.
But that energy.
Yeah, let's talk about that craziness and anxiety again. Is first thing I do in the morning is I get up and I don't touch a dog. Not even my own. I get up and I make my coffee and I don't even look at my phone. Like, I do me. Because you have to think about that too, is the leader of the pack does everything first. So the dogs start to learn that it doesn't matter if my alarm goes off. It doesn't matter what's going on. I will come get you when I come get you. And now they're not worried. You know, now they're just like, oh, you're going to come get me. And then coming out of the crate is you don't bust through that door. You know, you're calm and you're looking at me. It's permission-based lifestyle. It is what you do for your kids. Like, may I go outside? You know, may I have a snack? Is what you're asking of your kids is why aren't we asking that of our dogs that are not humans that don't understand? Right. And so then when you come home is don't go straight to your dog because the garage door, I've had many clients, as soon as you open that garage door, the dog's going chaotic, right? And you're going and being like, oh my God, I got to go get to you first. Your dog is screaming at you, come get me. And literally you are running as fast as you can. Some people don't even come home and pee yet. They got to go get their dog. You know what I mean?
Yeah.
Is no.
Right.
Like it's all about teaching your dog to have this, being able to be okay and be like, okay, they'll tell me what I can do and when I can do it and everything is great. I don't have to make those decisions on my own. And because if you think about this, if people are like, oh, you're micromanaging dogs. Yeah. I am taking a different species and bringing it into a human world. I'm taking a predatory animal and bringing it into a human world. So yes, I'm micromanaging, right? But also too, the micromanaging becomes something that is just fluent every day. The dog's like, cool, I open the crate door. Now I don't have to have a leash. My dog looks at me, I invite him out. Everything is just free flowing. But here's the thing is if your dog is allowed to make all these micro decisions, what do you think they're going to do when they see another dog? That's a big decision. Yeah. They're going to react because they get to make all these other decisions. Well, how about we make these decisions for them? And then the dog starts to go, I kind of don't like that. And they look up at you and they're like, what do we do about this? And then you tell them what you're going to do. That's how everything starts to come together. So it's not that spot cleaning I was talking about. People can't come to me and be like, I want my dog to be not reactive on the leash. That starts with crate training. Yeah. You're like, that's just one small piece of the puzzle. Yeah. 100%. It is interesting. I know we talked about this on the last episode that you were here, but I sent Oakley to you for leash reactivity. And I just want to say to the owners out there, I'm sure you're listening to this and you're feeling like this seems so, for me, like having to crate him, having to do all of this. I had to change my mindset completely as an owner. And that's not really something you're taught. There's no courses in school. I went to vet school. They certainly don't teach you that there.
And so it can really feel like, oh my gosh, how do I even like start doing this? But once you just start with it and stay consistent, it makes a massive difference. And watching him sort of decompress and just being like, oh, mom's got this. Like, I know my routine. I know she's got this. I have boundaries. It has made him into a different dog.
Yeah. And then we talk about too is like, it may not fix everything. People can, like, can you fix my dog? No.
Right.
I cannot make Fluffy love your children. I can't make Fluffy be a dog park dog, or whatever. I can't change what your dog is. But again, it goes into it is where, like, I mean, I tell people, if you have a reactive dog, it doesn't mean that after you've done all these things, they won't ever react, because that's life. You know what I mean? But here's the thing is, I tell people all this all the time. I say it all the time on my Instagram is you can't control the environment, but you can control your dog.
Yep. What does a day look like for you and Sailor? I think people would be interested to know, like, what does that, like a typical day, like average day, like how much activity are you giving him? How much time does he spend in his crate from sun up to sundown? What's that look like for you?
Oh, so a day with no dogs, just me and my dog, is the best day ever. But it's the same thing every single day. Is I get up and I don't mess with him. I do me, and then
he's in his crate overnight.
Yeah, overnight, 100%. And he's in his crate. He doesn't sleep in bed with me. He, is not on the couch. So he goes in his crate. I get up and I do my things. You know what I mean? And then of course out to potty. I also may take him to potty, and I may put him right back up because maybe I need to jump in the shower. Or do something or whatever. He doesn't have to be involved with everything that I do. He's also a dog that somebody recently I talked to, is there some dogs that are like criminals, that they have to have life in prison or they will continue to commit crimes? That is Sailor. Sailor is a dog that if I am not, on him and he is on place or he is being controlled, if I jump in the shower, I can't imagine what my house would look like. He's trained.
That's a German short-haired pointer for you.
Yes.
They're too smart for their own good.
He is just, he's a dog on crack. He's ready to go.
Yeah.
But then typically, of course, too, as he goes out, and then the calmness before a walk is I'm having my coffee and he's laying on place.
Place for people listening a place you've taught me can really be anywhere in your home, but you recommend these sort of elevated cot like beds. You can find them on Chewy.
Yeah.
And you put your dog on place and they're not allowed to get up until you give them permission to.
It's like an invisible crate, and that all starts with tethering. Then you add the bed. And so he knows, so we come in, and just because he went outside to go potty and now we're in the house, it's not a free for all. Yeah. This is my home. I don't allow craziness in my home. In the home is peaceful. Outside, we play, we hike, we do all the things, but inside we are chill. Mm-hmm. And so he's laying on place, and I wait for that calmness to come in. And then when I am ready, then I invite him to go with me on a walk, and I don't let him run out the door. And
that's been huge for Oakley and I.
Yeah. It's all about impulse. His dogs just go, 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 go. And so again, it's that permission base. He knows I put his leash on and I may go, oh, I forgot my key or I forgot my phone. He's still sitting there waiting for me to go on this walk, but calmly, and then we go out, and then your structured walk is, your dog is, here's another thing about anxiety is if your dog has anxiety, your dog should not be in front of you on a walk. Because whatever is in front of the pack or whoever is leading the pack is telling you what is happening. They're advocating. They're saying that, hey, there's a dog and I'm going to react, or there's something that's scary and I'm going to do this. So he's following me through this whole walk. It's that follow process. So again, it's everything is to him is instinctual of I trust you and I also respect you enough that you're going to lead me into a path.
So then you go for your walk. Mm-hmm. How long's your walk? Like typically most owners, it can be anything.
Anything. Okay. It's not about how long it is. It's about what it is. Mm-hmm. It could be, I could come out and there could be, I have a field and Sailor's a bird dog is the field. I had geese this morning. I'm like, I don't even know. There's not even a pond. You know what I mean? Yeah. I'm like, what is this? And he's out and you can just see him. He's just trembling.
He's like, let's go.
Instead of actually going on a long walk, we worked on focusing with me and walking with me and going into non-verbal, doing all the things. We literally didn't leave in front of my house. Mm-hmm.
I have found, and I had the misconception with, having Oakley that, gosh, we've got to run him to get so much energy out. But I find that he's more exhausted when we do our training walks where I make him sit. And then he works on his recall, like making him mentally stimulated makes them just as tired.
Oh, absolutely. Because even too is I like to take environment. So I tell people like, again, Always Training K9s, I'll find something and I'm like, I'm working right now. Mm-hmm. We're working through this and going through it. And that is more on a dog to have to be way up here, overstimulated, scared, nervous, excited about something and working them down was a lot better than a long walk.
Right.
But of course, you know, fish swim, birds fly, dogs walk. Is, you know, it's nice to have a good, you know, walk, but it's also too is they don't need to be walked. So if you think about their migratory animals, they walk in the morning, they walk in the evening. And then most of the time during the day, they are asleep.
Yeah. I think that's so important for owners like that aren't professional dog trainers to say it's okay. Like they can wake up in the morning, do your routine, get them fed, meet their basic needs. They can go potty, go for a walk, and then the rest of the day, like it's acceptable for them to be chilling in their crates.
And it's super cool too is I don't have a time, like I don't have a set time that my dog walks. I don't have a set time that my dog eats. That so even too as you think about this is I have many owners or many dogs that come in and it's like 4:30 and they start whining and barking.
Oh yeah.
My dog gets fed he gets fed. He gets morning and he gets evening, right? But it's never a set time. So he's never worried about, you know, especially too, we just went on vacation and crate training. I brought my Rufflin and it was fantastic. I could leave him in the hotel room and he was like, this is a piece of home that I know that I feel comfortable in. He also knows he gets fed in that crate. And again, I could be out on my vacation and not having to worry that my dog, you know, was in there sweating because it was 4:30. No, he gets fed when he gets fed. And because if you think about this too is, again, a dog is an animal and a feral dog or any dog that's out is they eat when they can find food.
Yeah.
So what we do as owners, I see it is we just are so on like, I have to feed my dog at 5:00 or my dog has to be fed at 6:00 or all of these things. And so we make our dogs so anxious because if they don't get that at the moment, then they don't know what to do.
Right.
So the routine is something that you do every day, but it's also too is not that controlled.
Like it's okay they need to learn to be adaptable.
Oh, of course, because life happens.
Right. Dang, I feel like listeners listening to this are like, I'm such a bad owner. I know for me, like I was like, I am just missing the mark. And it feels like you're at the bottom of Everest, but I can assure you that you're not. And one thing that I think anywhere that you live, finding a trainer is important. We talked about in our last episode how to find a good trainer. And then also your Instagram has so many, I think it's great because you show videos of you training and why you're doing what you're doing. And so I learn a lot just from following you on Instagram, honestly. So I would recommend people do that for sure. When are you like, and I know we've talked about this before a little bit, but at what point are you like, hey, maybe this dog needs to be on anxiety medication? And I'll say that as a veterinarian, I get this pet for 20 minutes. I'm trying to look at their blood work and check out their teeth and convince the owner that this dog really needs a dental. And then, by the way, Fluffy's anxious. And I'm like, it's a lot. So I guess, you know, I rely heavily on my trainers to let me know when do you think it's time for them to be on medications?
It is, I'm going to tell you, it is very rare. I'm just sitting here thinking, like, when's the last time that I recommended? And I haven't, because literally the training that I do, it's more dog psychology. Obedience doesn't fix anything. It's how you live with your dog, how your dog sees you. And going into that is, you think about this, is it works. If the owner works it and does the same thing and is able, like you said earlier, is like changing your mindset. You know, if I have an owner comes, it's like, no, I'm not going to crate, and no, my life is too hectic, I'm not taking that dog in.
Right.
Because I'm not putting the dog through that stress for it to go home and go back to the way it was living. Now, again, if a dog is, you know, comes to me and again is like breaking out of the crate and doing that, I may be like, hey, can you have some trazodone on hand? You know what I mean? But again, it has to be like they're self-harming themselves. But let's talk about genetics. But here's the thing of this is like, I have dogs that come in that I have to, as a trainer, I have to step back and be like, I did the best that I could. And I did the most that I could with this dog, but this dog isn't going to be a dog that wants to go to Lowe's, that is going to be comfortable enough. And and owners have to realize that what happens is when we see dogs, we have this visual of the best dog in the whole world that loves everybody, loves everything, but that's not every dog. And as a trainer, I have to realize that I can't change what Fluffy is. We can make it better. We can manage things, but also too is like, if I have to give a dog trazodone to go to the coffee shop with me,
probably not worth it.
It's not worth it.
Yeah.
It's not worth it. You know what I mean? Or if I have to now here's the thing, if the dog is terrified of fireworks, you know what I mean? Is like,
yes.
I mean, like that is something like thunderstorms,
totally.
You know, if you have to travel with your dog and it's like supercars, but you have to do these things for the well-being of your dog,
right,
or life.
Yep.
That's when I'm like, it is okay. You know what I mean? Like, it is okay to give your dog something like that, to just be like, hey, let's get through the holiday. let's get through this traveling. We're moving across state. You know what I mean? Something like that is fine. But if it's like because of you're wanting your dog to be a certain way and want it to accompany you somewhere and it hates it, no.
Yeah. That's really important to point out, as there is situational anxiety like fireworks and thunderstorms, and trazodone is a great option for those situations. I think it's really important for listeners to remember you want to give that medication 2 to 3 hours before the event that makes them anxious. I know that can be hard because you feel like you have to be like a meteorologist watching the radar, but if you give it and they're already a little anxious, it's not going to work. So timing is really important with that. And I will say there are some dogs that I will put on generalized everyday anxiety medications for whatever reason. Maybe they have worked with a trainer and they're not making headway, or the trainer even recommends it. And so I would just say, if you are going down that path with your pet, make sure you talk to your veterinarian. I personally would not want my animals to be on trazodone every single day. That's one that really kind of like makes them feel kind of like dopey and kind of zombied out. So there's other options out there that help take the edge off, but still allow your pet to have their personality and not to feel like numb almost. So
when they come into training, I don't want a dog on trazodone.
Right.
I recommend that they wean them off. They have to be weaned, right? Weaned off I don't want a dog to come in on that. I want to see the dog at its fullest level of going into it, because then it's like, I mean, it's a Band-Aid. So if the dog's coming in, it's like, I've had 3 beers.
Yeah.
And it's, it doesn't want to attack me. And I'm like, oh, look, I cured your dog. No, like I want the dog to be fully into it. And then like, again, going into it is if you have done everything in your power. Like you literally can be like 100%. My trainer and I have worked so hard, and we are just this dog just does not feel well. Then I'm thinking genetics probably going into it. Then let's look at that route.
Yeah.
But if you have not even reached out to a trainer or started, or you're just like, I can't handle this.
Yeah. First and foremost, behavior modifications always. And then medication as a supplement to kind of help with those behavior modifications if you're not making headway.
Yeah.
So, well, Nikki, I feel like...
Are you overwhelmed?
I know.
You are
I love
like,
it.
wow.
No, I love it. I just think so many people are going to listen to this episode and be like, oh my God, like I have so much work to do as an owner, but it's so important. I think that all of your points are so valid, and my gosh, I think, you set the standard for being a pet owner for sure.
And if you just remember, it'll always be hard if you do easy first. It's easy, hard, right? If you do easy, it'll always be hard. But if you do the hard stuff first and you stay consistent and you just repetition, right, then it will become easy. It will become a lifestyle that you can enjoy your life with your dog.
Totally. All right, guys, we're going to take a quick break and we'll come back for Paw in Order. On this week's Paw in Order, I am going to tell you 3 things where, as a veterinarian, I would not do with my own animals. Number 1, I would never express my dog's anal glands, or most of you are probably having your groomers express your dog's anal glands, I hope. I would not have my dog's anal glands expressed unless they absolutely need it. Anal glands are weird. People are always like, what are these things? And
it is the most god-awful smell I've smelled in my life.
Smell that you will never forget.
And it lingers. If you get it on you, it's just...
One drop on the clothes, they're ruined. Throw them away. Don't even wash them.
Especially in the face, right? In that way?
Oh, yeah. Yeah. If you guys haven't heard that episode, I don't even know what episode it is. I've tried to block it out of my memory, but I got anal glanded in the face, the mouth, the eyes, the hair. It was awful. Anyways, anal glands, people ask me about them all the time. I don't know why dogs have them. They are probably what we call a vestigial structure, meaning at some point they served a purpose. At this point in time, they do not. Most dogs are able to express their anal glands on their own when they're going to the bathroom. If they can't, then you will see them scooting their butt along the ground. They'll be licking back there a whole bunch. Or, like Nikki said, you will smell the smell of all smells. In which case I say, yes, get them expressed. But if they're not doing any of that, let them do it on their own. Because once you start, you might have to keep doing it.
Oh, that's good to know.
And if you have a dog that really needs them expressed, like we're talking like every month or so, every couple of weeks, it may be something in the food. It could be like a food allergy. There's different supplements you can try. So make sure you ask your veterinarian about that.
Yeah, I've heard that little dogs are more prone to having
anal gland issues.
That's what I've heard. I don't know if that's true.
I don't know.
Because they say like big dogs can express them easier if they bark or anything like that. But little dogs, I feel like that's just what I've heard. I don't know if it's true.
I feel like it's 50. I'm not really sure. You would hope it's the big dogs because they've got the little dogs. I'm like, I am so sorry that I have to do this to you.
I'm sure it's hard to find.
I did have an owner the other day who was like, can I watch you do this? And I'm like, I mean, come on in. Actually, it was Mackenzie Porter's husband. Sorry to call you out, Jake.
Oh, Jake.
But he's like, I kind of want to learn. Like, maybe I could do this at home. I'm like, yeah, come and watch. And then afterwards, he was like, I will never do that ever. Like, I didn't think so. Okay, number 2, I would never feed my dogs together without supervising them. I had a client the other day who has 2 dogs. They have never gotten in a fight. They get along amazingly. She puts both bowls down in the kitchen, walks into the other room, is on the other side of the house, hears Nikki's shaking her head. She's like, no. I don't even know what she heard, but she went running in the other room. The big dog has the little dog pinned on the floor. And they are fighting over the food bowls.
Crate. Feed your dogs in the crate.
Feed your dogs in the crate. Nikki's going into the grave going, crate.
Yes. That is just, because I always feel this, they say, my dog is never. That's cool. But guess what? They can and they will. So if you ever say my dog is never, they will never like they nevered before.
Yeah, right. Exactly. They will never like they've never. I love that. Never before. You need to knock on wood.
Yes.
If you're not going to feed your dogs in the crate, at least wait the 5 minutes until they finish their meal to keep an eye on them. Keep those bowls like at least on the opposite side of the room because at the end of the day, they are animals. They are unpredictable, and food is one of the biggest resources in their life. And they can do things that they've never done before.
And then pick those bowls up.
Yes.
Don't leave them. Don't let your other dog go lick the other dog's bowl. As soon as they're done, pick them up, wash them, put them on your counter because even if it's empty, they know that's where it comes from. And I've seen dogs guard an empty bowl.
Yeah, that's a really good point. Okay, number 3, I would not perform a dental on my pet under sedation rather than anesthesia. There is a huge marketing push right now for anesthesia-free dentals in our pets. And I'm the first, like I get it. I understand wanting to avoid anesthesia at all costs, but the reality is there is still some risk involved with sedation. And honestly, you are better off just brushing them at home. These anesthesia-free dentals, they really give you a false sense of security. Yes, your pet may have like clean teeth. They might look clean after, but that doesn't mean that they necessarily have a healthy mouth. They're only able to clean the visible surfaces, and 60 to 70% of dental disease in our pets is below the gum line. I can't tell you how many times I'll look in a pet's mouth and think, oh yeah, they just need a cleaning. And then I take an x-ray, which is what we do when they're under anesthesia. We take dental x-rays and they have a massive abscess around one of their tooths. The difference between sedation and anesthesia. Sedation, they're giving an injectable medication that's just calming the pet. Pet is still awake, can still feel pain, which
so it's like us going to the dentist,
correct.
Right? Getting numbed and still getting drilled on.
Exactly. Yep, exactly. Also, they're not able to do all the things that we can do when they're under anesthesia. So under anesthesia, it's like you've got a breathing tube in, you're completely asleep. They are not conscious, and we're able to really get in there and take x-rays of their teeth. We can scale the inside of their teeth, probe everything. So sedation dentals is just cleaning. It is not like a full oral treatment, and you're going to spend a lot of money. Yes, you're going to avoid anesthesia, but it's not overall what's best for your animal.
I didn't know that. I didn't even know that was a thing. I thought if you had to do any procedure, put your dog under, like
definitely. I mean, there's a big push right now because people don't want to put their dogs under anesthesia, which I can understand the concern. Albeit the likelihood of anything happening is highly, highly unlikely. So yeah, I think honestly, I feel like pet parents are getting taken advantage of because they are nervous.
I'm sure. Well, let's say like an old dog and it needs just a cleaning or anything like that. That would be a better route, right? Because it's harder for an older dog to go under anesthesia, or still it doesn't really, not really going to do the benefit that you're talking about.
It would not even, I wouldn't even do the sedation. I would do the anesthesia. I mean, an old dog is not a disease. Age is just a number. So as long as their kidneys and their liver and everything's functioning okay, I anesthetize old dogs. I anesthetized a 17-year-old dog the other day and did a dental on it. Did amazing. Popped right up. Did better than the 3-year-old dog. So
oh, really? That is something. Because anytime, you guys know that I have a 16-year-old border collie. That, they're talking about any kind of procedure we have to put her under, and I'm like, no, she's not coming back.
I know it is. I mean, it's us being really afraid. But if you think about it, like 90% of well, I won't say 90, but a high percent of humans that are going under anesthesia for procedures are almost always the elderly. You know, they're getting tons of procedures done and they're going under anesthesia. So just because they're older does not mean that their risk under anesthesia is that much greater.
It's good to know.
Mm-hmm. So yeah, that's my tea for the day. Thank you guys for listening. As always, Nikki, where can the listeners find you?
If you go on Instagram, you can find me under Always Training K9s, and you give me a follow. You can see my stories. And I also want to let you guys know, shoot me a DM. If you have questions, let me know. I love to talk to people. You don't have to actually be a client. Is you shoot me a question and I'll talk dog to you all day long. I'm here to help you guys. And again, is you'll get to see, it's free information. I start with crate training. So anytime I get a new dog in, you get to see from start to finish what that looks like. So if you got a dog and you see me with a new dog, you're doing the same thing that I am doing. And then if you have trouble, shoot me a DM and we can even and even if you're not in this state, I do Zoom consultations where I can work with you and your dog over Zoom. It's not great because of course it's not hands-on, but we can definitely get some things going on that as well.
That's awesome. Well, thank you for coming in. I mean, I feel like we talk about you on this podcast. We just had Jason Tardik on. He's like, Nikki's the best. You work with all the WAGs dogs. So, and I know the listeners have loved learning from you as well. So thank you for coming.
Oh, thank you for having me back. I love it.
You're welcome. We'll probably see you season 4. And then as always, guys, you can find me at Dr. Josie Vet on Instagram and TikTok. Although my TikToks aren't really that great, but find me on Instagram. Send me your messages, DMs. Let me know what you thought of today's episode. And please be sure to subscribe. We are on YouTube, so you can watch the episodes there. And then like, rate, review on any platform where you get your podcasts. And we'll see you next week.